Moving very quickly to our first speaker, I would like to invite Dr. Bilal Hameed. He is currently working as Associate Professor of Medicine, Director of Transplant Hepatology, Fellowship and Associate in the Clinical Chief of Hepatology, University of California, San Francisco. He is also a member of ASLD and American Society of Transplantation. He has long-standing interest in the NAFLD, HCC, liver transplantation, and ACLF, with numerous publications in reviewed journals on these topics. So he will be presenting epidemiology of the NASH, global and regional perspective. Sir, thank you, please.
PSH team, to Professor Altaf Alam for the kind invitation. To be honest, when the COVID-19 happened, 2019 I was here, and then we didn't know what was going to happen with the travel and with our health. But Alhamdulillah, I'm happy to see everyone here, and hopefully this will be a very successful meeting. So I am the opening batsman today, and hopefully I'll do a good job like yesterday. What Babar Azam and Rizwan, congratulations on an amazing victory. So the topic which was given to me was epidemiology of NASH, global and regional perspective. These are my disclosures. So all of us, you all know about the progressive nature of non-alcoholic fatty liver disease. It starts with a normal liver and then development of the fat. And there are multiple different pathophysiological factors like insulin resistance and other factors that lead to it. And then some of these patients will just have isolated fat, which we call isolated fatty liver, which does not have that much chance of progression. However, when you have inflammation and balloon hepatocyte, which we call steatohepatitis, those are the patients who are at risk of progression, which ultimately lead to cirrhosis. And then once you have cirrhosis, you have at risk of decompensation and hepatocellular cancer, which I know Dr. Koh will talk about. But let's talk about the risk factors before we go into the prevalence. These are common established risk factors for non-alcoholic fatty liver disease. We're all aware about obesity, type 2 diabetes, dyslipidemia, metabolic syndrome. But one thing to remember is polycystic ovarian syndrome, because of insulin resistance, is also very commonly associated. There are some other risk factors or association, I would say. So hypothyroidism, obstructive sleep apnea, hypogonadism and pituitarism, and also psoriasis have been associated with non-alcoholic fatty liver disease. But when we look at the comorbid conditions that associated with NAFLD and NASH, if you compare, this is the US data, and I would imagine that the rest of the Western world and also Asia will not be very different in this. So if you take obesity, which is about 39% in the US population, in fatty liver NAFL it's 51%, and NASH it's up to 81%. Same with hypertension, type 2 diabetes, and dyslipidemia. So the bottom line is the more comorbid conditions you have, the more risk not only having fatty liver disease, but also the more severe form, which is NASH, which will be at risk of progression. But we also aware about that NASH shares a very common biological basis, not only with diabetes, but also cardiovascular disease. But the center of it is the weight gain, whether you can consider obesity or waist circumference. This causes abnormal metabolism, fibrosis, and inflammation. And this happens, same factors that happen in cardiovascular disease. You have inflammation ultimately lead to atherosclerosis and fibrosis of the blood vessels, same with the pancreas, and same with the development of fatty liver disease and ultimately fibrosis. Now this has been published in 2016. I'll show you some updated data about the global prevalence of non-alcoholic fatty liver disease. So if you take about that, about 24% in North America, 30% in Latin America, and about Asia is about 27%. But if you take all those things, about the estimated 1 billion people, or now slightly more, have non-alcoholic fatty liver disease. And 25% of those patients with non-alcoholic fatty liver disease has NASH, so it's about 250 million people. And out of those, estimated 9%, which is close to 22 million, will have advanced fibrosis. This is some updated data from Zubair University, which has just got approved at Journal of Hepatology. When they look at the global and regional prevalence, the pooled prevalence of fatty liver is about 30%. But it also depends upon how the studies were done, and it differs from the modality. The CAP score, which is for transient elastography, Some of the studies have the prevalence is much higher, same with the MRE. So depending on which modality you have used, the prevalence also changed with non-alcoholic fatty liver disease. Now, one thing I wanted to focus on in South Asia and also Middle Eastern country, that prevalence has been increasing significantly. And I'll show you some more data about association with diabetes, which is one of the big factor in this part of the world, but also in other parts. So in South Asia, it's up to 33% now, and based on the newer studies. And when we look at the global prevalence increasing, this is from the same paper. So in 2006, about 25%, and now up to 38%. So clearly, we have seen the increase in the prevalence of non-alcoholic fatty liver disease. This is a study I wanted to focus on. It's from America. And what they did, it was Chief Harrison and his group in Texas, where these patients were coming in middle-aged adult. It's a VA study, so it was mostly male. They're coming for screening colonoscopy. They had 664 patients, no prior history of anything. They just asked them to get enrolled in the study. They did an MRI, fibroscan, and liver biopsy in these patients. Pretty impressive study. Median age, mean age was 56, and the BMI was 30. So 38% of the total cohort, without no prior history of any liver disease, had fatty liver disease. And out of those, about 6% already had stage 2 or higher fibrosis. So this is what we're talking about. It's asymptomatic disease. And my next talk with diagnosis and management, I'll talk about more about how these patients present and what is the evaluation that we see. In America, at least, we know that Hispanics have much higher rates of fatty liver disease and NASH. But again, obesity and type 2 diabetes will keep coming back and back when we look at the prevalence of fatty liver disease. This is some data from Asia, and which is the NAFLD. A nice paper in Journal of Epidemiology from FAN in 2017. And they looked at the general population for non-alcoholic. And depending on what the studies they have looked at it, in China it's up to 40%, in India up to 30%. And same with Japan and Korea also. Now, you can also imagine that waist circumference has also a big part in our evaluation because the obesity and how you calculate BMI is different. But if you look at the BMI of less than 35, which we call 25, which we call lean, it's up to 20% in China, and India is about 7%. Interestingly, we all know that non-alcoholic fatty liver disease does not only happen in patients without liver disease. Now we are seeing many patients with hepatitis C and hepatitis B or other liver condition with non-alcoholic fatty liver disease. So in some of the studies from China, it's up to 50% with hepatitis B patient has metabolic syndrome and also fatty liver disease. Now, some people do talk about like lean NASH, which is mostly seen in Asia that we see it based on if your BMI is less than 25 or in Asia it's less than 23, it's a lean fatty NASH. Different estimates up to 7% in United States, but 19% in Asia that we see fatty liver disease secondary to lean, which is BMI of less than 23 or 25. And this is some of the data from multiple different countries, and depending on how the studies were done, the rate of lean BMI can vary. But the important thing is lean NASH also share a common altered metabolic and cardiovascular profile. When we look at the complication, these patients also at risk of increased cardiovascular and also sometimes increased mortality. Now, this is a very interesting study that looks at the global prevalence, the data which I showed. But below you're going to see is that correlated with the calorie intakes. So again, the more calories we take, the obesity. And so if you have the Western diet has about more than 3,000 calories a day. And so the more calories you eat in a day, and that's one of the recommendations that we have, our patients have low carbohydrate and low calorie or Mediterranean diet. But clearly the prevalence of obesity worldwide is increasing, and also in our part of the world, the calorie intake has been increasing. Now, some of the prevalence of obesity in Asia, you can also see that Middle Eastern countries that we have talked about increase in not only fatty liver disease, diabetes, but clearly an increase in the obesity. Again, the data in Pakistan is not very well available, but Pakistan is inching towards it. although, it's still less than Middle Eastern countries and even Malaysia and China, but we are clearly seeing that trend. And in China, you can see that the increase of the obesity is increasing. Now, the second part is the type 2 diabetes. And clearly, this is one of the major risk factors for non-alcoholic fatty liver disease. So the global prevalence of non-alcoholic fatty liver disease among type 2 diabetes about 55%. And this is some of the updated data that I will kind of like to show it to you, that in some of the newer study, the prevalence of fatty liver in type 2 diabetes is 55 to 70%. And the global prevalence of NASH is about 30 to 40%. And about 12 to 20% of these patients will have advanced fibrosis, stage 2 or 4. So when we talk about some of the risk factors and when we have this holistic approach of fatty liver disease, which patient we will going to be approaching and how patient will be at risk. So obesity and type 2 diabetes will be again a very important factors. And when we look at the diabetes situation in Pakistan, clearly it's very, very alarming. There is a 70% increase of diabetes since 2019, and I think our endocrinologists will definitely have more input about it. And some estimated 1 in 4 adult in Pakistan with diabetes. And now Pakistan ranked the third following China and India in the world with diabetes. So if you are not seeing fatty liver disease, it doesn't mean that it's not present, it's that we are missing it, and our clinics will be full with fatty liver disease in the near future. Similarly, when we look at the prevalence of type 2 diabetes and fatty liver disease based on different modality, depending on if you use the CAP score or control attenuation parameter, you will definitely have more chance of finding. And so it also varies, but clearly, as compared to general population versus type 2 diabetes, fatty liver is much more common. And similarly, when we compare patient with obesity and type 2 diabetes, the more obese, more diabetes you have, more chance that you have fatty liver disease. So fatty liver disease and type 2 diabetes have this bi-directional relationship. Diabetes does promote increased risk of steatohepatitis, increased risk of cirrhosis and cancer. And same with NAFLD promotes worsened insulin resistance. So there was an increased dyslipidemia, increased risk of type 2 diabetes, and even hard to manage. In patients with fatty liver and type 2 diabetes, we do have more difficulty manage it and increased cardiovascular disease. Lastly, we're gonna talk about why it's important. We talk about the prevalence, but what is the severity and complication? So NAFLD is a progressive, as I mentioned, and then it goes from, so 20-30% of patients with NAFLD will have NASH, and 25 to 30% will have advanced cirrhosis. So one of the questions that most of the time the studies have done, that fibrosis progression rate in NASH is about 1 stage per 7 years. But there are patients who are rapid progressor. If you're drinking alcohol, the more comorbid condition they have. And then at the same time, 20% can lead to cirrhosis in about 10 years. Most of you are aware that the common causes of death in NAFLD is basically cardiovascular is the #1 cause of death. But also we have seen beside HCC, which Paul will going to talk about, there are increased risk of other cancers, extrahepatic cancers that we have seen. Colon, esophagus, stomach, and pancreatic cancer rates have been same with kidney cancer in males and breast cancer in female. And now this is a nice study which was done in 2017. Look at the estimate, like what we in the future by 2030, how it will gonna look like. And then the burden of disease in the US will gonna be significant. And I think this will correlate with rest of the world, that we anticipate that 178% increase in liver death, so about 78,000. Incident HCC expected to increase by 137% and liver transplant by 59%. So this is not only that we have seen increased prevalence, we are going to see increased complication from liver disease. This is our New England Medical Journal article from NASH CRN, which Arun was the first author. So this was NIH had this study for more than 15 years. We had about close to 1,700 patients with biopsy proven NASH, which we have, or fatty liver disease, which we followed. So this, in this study, the median follow-up about 4 years. But one thing has been clearly that the more advanced fibrosis or cirrhosis you have, the more complication. not only liver-related complication, liver cancer, which is expected, but overall, all-cause mortality or mortality increase when your fibrosis is much higher. And this is similarly some of the all-cause mortality data that we have seen. In green is F4 fibrosis or cirrhosis. So the more cases you have, the more advanced fibrosis, the more complication you will gonna have. Now, the global burden of this is a study which they actually looked at the incidence of cirrhosis, right? And this is based on the NASH in about 195 countries. And clearly from 1990 to 2017, the global burden of liver cirrhosis is increasing, which is because of non-alcoholic fatty liver disease. And similarly, like our study, this was from the global burden of disease data from 2009 to 2019. And they were interested in looking at the liver complication from NASH. And clearly there are, since in 2019, there is increased death from the liver cirrhosis and complication. And then also the most of these were happen in Asia and Middle Eastern countries. Again, our part of the world is at increased risk and we have to start paying attention. And there are a lot of different factors about dietary factors, metabolic risk factors, but also low physical activity has also been associated with this. Similarly, the worldwide increase in HCC is related to NAFLD, and in India you can see the numbers, and Pakistan. So we were going to see more HCC cases because of non-alcoholic fatty liver disease, and we're not talking about the big elephant in the room of hepatitis C. So in combination of these, the HCC will be significant burden in our healthcare, which has already been an issue. This is what I was talking about, the outcome from the lean NAFLD. So initially thought that lean NAFLD may not be has that bad outcome, but the more studies that it can be independently associated with mortality, and especially cardiovascular mortality. Now, one thing I also wanted in the same study that from New England Medical Journal, when we followed these patients, we also found that when you have the more advanced fibrosis you have, so in red you have the incidence of events. So more chance of developing hypertension, more chance of chronic kidney disease and type 2 diabetes, so in the core. So when you have advanced fibrosis, not only you have liver-related outcome, your other complication of developing type 2 diabetes, hypertension, and chronic kidney disease will increase. Similarly, when you have fatty liver disease with diabetes, your risk of micro and macrovascular complications started happening, increasing. And all of us knows that cardiovascular disease, this was a big study that would then, and they found that, you know, when you have fatty liver disease with diabetes, your risk of cardiovascular complication will be much, much higher. So in summary, the global burden of HCC, of NASH is growing. NAFLD and NASH will be the leading cause of cirrhosis, liver cancer, and need for liver transplantation. NASH does have a common biological basis with cardiovascular disease and type 2 diabetes, and still the #1 cause of death in NAFLD is cardiovascular disease. Thank you, everyone, and I think we're going to do the question answers at the end. Okay, thank you.
Thank you very much, Dr. Bilal. Again, request if you, somebody is writing the questions, they just raise their hand. So our team members will be collecting all the questions from them.